You will begin by first typing in your participant ID. Then you will click on the Practice orange block button, then the Yes button, and then click the I'm Ready button. Since you are Group C, you are able to use the buttons on the right and left-hand sides of the interface. You also have visualization and access to the integrated tutor. Here is the phantom, which represents the patient's back. On this simulator, the most cranial rib is rib 3, and the most caudad rib is rib 8. Depending on the specific objective, you can change the angulation of the patient's back and orient the patient from a sitting position to a lateral position. If you wanted to, you can even orient the patient to a prone position. In this prone position, you can move the patient to having their head either to the left or to the right side. You will use the tools in front of the simulator to assist you when performing the blocks. The first tool is the ultrasound. This is not a real ultrasound, but it is more so a mixed reality ultrasound. On the ultrasound, there is an orientation marker, and the computer screen represents the ultrasound screen. In order to facilitate movement with the ultrasound, you have to use baby powder. When you place the ultrasound on the simulator, you will see the ultrasound image pop up on the computer screen. Notice that the orientation marker is in the top left corner of the ultrasound image. The next tool is the block needle. This needle has depth marks and wings to hold. The next tool is the search needle. This needle is used for simulating numbing tissues and palpation. You can simulate injections with this needle as well by poking through the skin and injecting air. The next tool is the loss of resistance syringe. This syringe is attached to the block needle. You use this tool to advance and check for a loss of resistance. Lastly, you have your Sharpie marker, which is used to mark the simulator. There are two additional buttons that the simulator has. The first button is the hydrolocation button. When you need to hydrolocate, you can use your foot to press this button. When you are finished performing a block, you need to press the needle in place button so you can be scored. When you are finished with the procedure, you can use the alcohol provided to wipe your markings and begin your next block. Click the Practice a Block button in the bottom left corner. When you click this button, choose the technique you want to use for your practice session and then click the type of procedure. After clicking which procedure you would like to perform, specific instructions for what side and level to perform the block on will pop up. Click the OK button when you are ready to begin and then perform the block. When you are done, click the Needle in Place button and rate your performance for the block you just performed. If you want to keep practicing, just click the Practice a Block button and choose the specific technique and procedure you would like to practice. If you start and drag your mouse to the right side of the screen and click on Visualization mode, you can get the 3D picture of what is below the skin. The important tool to use that will allow you to change your point of view is this little camera tool. When you push on the button, you can move the camera in any way you want. When you are satisfied with your view, all you have to do is release the button. As you move the camera around the simulator, the point of view will change. You just have to be careful when changing your point of view because if you zoom in too close, you will have a distorted perspective. Just as an example of what we mean, if we inserted the needle in this view, it seems to be angulated medially. However, if we go to Preset Views on the right side of the screen, This will display our orthographic view. You can now see that the needle is actually relatively straight. If you wanted to record a procedure, you will first click the Record My Procedure button. Then you will perform the procedure. After you have performed the procedure, you will take the needle out and press the playback button. After pressing the playback button, you will be able to see the procedure you just performed. You can click the spacebar to pause the video, and you can also drag the moving play bar at the bottom of the screen to a specific point in any of the videos. Furthermore, when you are in playback mode, you can change your point of view using the camera tool. This view is frequently useful when viewing videos of epidurals. The hybrid cross-section visualization mode is also very helpful when watching the playback of the epidural procedures. If you notice on the Visualization Mode button, there are three options to choose from. First off, if you click once, the first option will be your ultrasound screen test mode. If you place the ultrasound on the simulator, you will be able to see this image on the computer screen. If you click the Visualization Mode button again, this will bring you to your standard 3D view. In this view, you can change your perspective using the little camera tool. You just have to be careful when changing your point of view because if you zoom in too close, you will have a distorted perspective. Just as an example of what we mean, if we inserted the needle in this view, it seems to be angulated medially. However, if we go to Preset Views on the right side of the screen, this will display our orthographic view. You can now see that the needle is actually relatively straight. If you click for a third time, you are able to use a visualization that cross-sectionally cuts the 3D anatomy. This is known as the hybrid cross-section mode. So for example, if we were to change our point of view to the side and advance the needle in, you can see how the needle creates a cross-sectional cut on the screen. Another way to visualize the cross-section is by using the ultrasound probe. When you click the Anatomic Difficulty button, this will change the dimensions of the thoracic paravertebral space by adjusting the depth of the lung. This button also allows you to change the depths of the epidural space. The next button is the Cognitive Aids button. When this button is clicked, there are many aids that will assist you when you are performing the procedures. To start, we will discuss the cognitive aid that will help you in determining the correct ultrasound probe position. If you click this button once, the cognitive aid of the ultrasound probe position will pop up. If you place the ultrasound on the surface of the simulator, you will be able to see clearly if the probe is tilted, inadvertently rocked, or if it is correctly oriented. If you notice on the cognitive aid, the level mark corresponds to the tactile marker on the probe. If you place the probe correctly, you will see the level mark to the left on the aid and the screen mark to the left on the ultrasound screen. If you place the probe incorrectly, the marker on the aid will be to the right, while the screen marker will be to the left on the ultrasound image. The next cognitive aid is the aid related to needle perpendicularity and trajectory. When the needle pops through the skin, you can see if the needle is perpendicular to the surface using this cognitive aid. If you look from the side, you will have a better view of the future projection site, and you can see the depth marks on the needle. You can also see the depth marks on the trajectory. You can see with the aid that the needle is perpendicular to all planes in this picture. The next cognitive aid is related to live ultrasound-guided needling. This aid is the view of the needle from the ultrasound probe's perspective. This is a great tool to help you with your ultrasound alignment and your needling. When you place the ultrasound probe and put the needle in the correct position, you will see this cognitive aid pop up in the bottom left-hand corner. The red line represents the ultrasound beam, and the little red dot on the top of the beam represents the probe orientation marker. If your needle is in plane, you will have good visualization, but be sure to note that probe manipulations will affect your alignment. When using this aid, if you move the needle, you can see it being moved. However, when you move the ultrasound probe, the red ultrasound beam stays stationary. When you move the ultrasound probe, you just have to imagine that the needle is stationary and that the ultrasound plane is moving from the left to the right. The last aid shows anatomical labels of the specific ribs and transverse processes. The next button is the Ultrasound Realism button. If you click this button and then place the ultrasound probe on the simulator, you can see that the ultrasound image is in a so-called hyper-realistic mode. If we were to start needling in this mode, you can see the needle pretty well, despite a very acute angle of incidence. If we were to deactivate ultrasound realism, the needle disappears due to an unfavorable angle of incidence. If we were to redo this block with a much more favorable angle of incidence, you will be able to see the needle in a more favorable view. While you are starting out learning these blocks, we suggest that you work in this hyper-realistic mode. As you progressively get better, you should activate ultrasound realism. Always remember from the beginning to advance the needle at a proper angle. This orthographic view is the most high-yield view. You will be using this view about 80% of the time because it provides you with minimal distortion. In addition, in this view, you can also use the needle for marking and to approximate distances. If you keep pressing the Preset Views button, this will show you more views. These axial and lateral views are less important, but they are still useful. They are specifically good when viewing epidurals in the cross-hybrid visualization mode. If you use the ultrasound probe, this will cross-sectionally cut the 3D anatomy. If you click on Session Library, you can see multiple recordings of other good performances of these blocks. If you scroll over a title and click Replay, you can see the recorded video. While you are viewing the video, you can change your visualization mode, your point of view, and you can even activate cognitive aids. If you click on the Thoracic Epidural and Paravertebral Blocks button, multiple modules will pop up on the top of the screen. If you hover over the circles, you can see what each module is about. If you click on the module, a new screen will pop up. On this screen, there is a brief summary of the module with a video to help assist further. You can play or pause the video by pressing the spacebar on the keyboard. Using the mouse, you can pick and choose where you want the video to start or stop or skip to a certain point. When you are finished watching that video, You can click the Escape button on the keyboard to go back to the default screen, or you could just click another module at the top of the screen. The next button is the Quiz Time button. If you click on this button, there are about 20 high-yield questions that will pop up to test your understanding of all 4 blocks. These questions will be examples of questions that you will see on the final multiple choice test. These questions will also make sure that you are understanding the most important points of the procedures. When you click on the Practice Skills button, there will be 6 exercises for you to choose from. These skills are designed to expand the utility of the simulator and enhance your skills overall. The idea behind these 6 exercises is to drill specific sub-skills that are part of the entire procedures. The Explore on My Own button is pretty self-explanatory. All it does is take you out of the previous tab you were in.